Leslie actually gave us a new time frame, or did she say it was just going to be cut short?
I'll check and come back.
Thank you, Kerry. I'd really appreciate that. Okay, wonderful. So, hopefully you're all here to talk about financial well-being. And what I'm going to do is we've just done an update from a Greater Manchester perspective on the financial support and well-being that support for well-being that is out there. So I'm going to go through that. It is a set of slides. I've already shared the slides with the team, so there'll be lots and lots of links on the slides. You'll get the slides, so you'll be able to click through all of this once you get those slides. So what I think I'm going to try and do is zoom through it really quickly, and then hopefully we can have a little bit of a conversation about some top tips or kind of the things that people are finding most helpful, and we could share a little bit with each other. Yvonne, I wonder if I could ask you to go on mute. I think it might be your... Let's see if I can do it directly. Here we go. That might have worked. Okay, right. Let me just put my slides up and I'll go through them really quickly. There we go. Okay, hopefully you can see those slides up now. Is that working? Thank you, Kerry. You are my barometer here today, so I really appreciate it. Okay, so like I said, you will get a copy of these slides. So I mentioned this just now when we were doing the mentee, but good well-being is about who we are and where we're up to, not only in the workplace, but also across all the different aspects of our lives as well, so we can bring our whole selves and be the best that we can be in the workplace. We know that that's not happening for a lot of people at the moment because there are so many different challenges going on, and financial well-being is a massive one. We definitely saw that in the poll that we just did. Our well-being is something that's really personal to each and every one of us, so there isn't a one fix-all blanket that we can put into place. There are certain things that we can certainly pay a lot more attention to, and I know some of those were picked up in that feedback that we had through the mentee. And we are in the middle of, hopefully in the middle and moving towards the end, but maybe not yet, in the middle of the most significant cost of living crisis that I've certainly known since I was a young girl in the 70s. I mean, it's having a huge impact, not only on us as individuals, our home lives, but also the people that we support and serve as well. So our patients, the communities that we work in as well. So it's really important that we kind of are hopefully trying to do as much support, put as much support into place as possible. I've mentioned that well-being kind of impacts on that physical, that practical, and that psychological, and impacts of financial well-being definitely hit all three of those areas as well. So the worry that we have when we're concerned about being able to make ends meet, the impact that it might have on our lifestyles, and also the choices that we're able to make about how we live those lives as well. So really important. So hopefully this information is going to be helpful to you. What we do know is that financial stress is one of the biggest challenges that we're getting feedback on at the moment. So for where we've got feedback coming through about what people are worried about at the moment, job pressures, workloads, and financial stress are the three key things. Thank you, Kerry. I'm going to speak a little bit faster. And we know that it can lead to anxiety, to sleepless nights. So we know that insomnia is on the increase again at the moment. And that means that we're kind of really tired. I can't remember what it means now. Tired all the time. There we go. I've learned something new today. We also know that 2/3 of our employees or our workforce are struggling with their finances. And that of those people, they'll report at least one mental health challenge. So that might be around anxiety or sleep, like I say, or other things as well. And we also know that people who are struggling with their finances are 5 times more likely to feel a level of depression, whether it's diagnosed or undiagnosed, and just over 3.5 times more likely to have a level of anxiety. And for anyone who's been to any of the wellbeing work that I lead on, talk about this stress bucket, and actually more often than not the things that impact on our well-being aren't the big things. So it's not a single big event or incident. It tends to be the drip of the day-to-day stuff, and financial well-being is definitely contributing to that drip. So let's try and keep that tap at the bottom flowing. Okay, so I've got a whole host of different ways that you can kind of perhaps consider in terms of impacting on your well-being, financial well-being, and things you might want to put into place. So how we can make our money go further. We know that the average household spends the most money, apart from rent, mortgage, etc., the biggest kind of expenditure is food. So we've got lots and lots of work, links gathered around things about being smart with food shopping, about kind of considering what we do with our food waste. The guesstimation is that at least a quarter of the food that we buy may not get used because it goes out of date, or we just kind of don't put it to good use, etc., etc. So really important that we have a bit of a think about that. I know lots of people. I was reading an article the other day that for the first time it looks like Aldi might be the leading supermarket in the country. So we're all kind of making different choices, and our brand loyalties are also shifting as well. So just paying attention to kind of the patterns that we have and how we shop are really important. Things like bulk buying, it's only a bargain if you're actually going to use it. The amount of times we get enticed to kind of go, oh, I'll do a 2 for 1, or whatever that might look like, and making sure that the choices that we're making still impact on our well-being, so that we're kind of making good food choices as well. And that's really difficult when we're on the move, we're trying to keep at pace, and we're trying to keep our costs down as well. Some of you might know about the Too Good To Go campaign. Please check it out. It's really, really important. I thought I did, but I didn't actually understand the difference between a best before, a use by, a sell by date. And I know that there's lots of work going on to help simplify some of that with a RAG rated kind of arrangement. But it's really important that we do know kind of what our labels on our food do mean. There are lots and lots of places that have discounts, especially during the school holidays. And I think that it's all continuing from now up until at least Christmas. So, where you buy an adult meal and you get a child meal free, or you kind of get a discounted arrangement. One of the big things I'm talking about at the moment is go and shop at Asda. As a health and care worker, you get 10% off all your Asda shop, excluding baby milk, nappies and medicines, I think. So 10% is a lot, especially if you're doing a whole family shop. I do it, I know it makes a massive difference. So please do that. You can use your NHS card, or equally, if you haven't got a blue light card, there are lots of different kind of discount arrangements. So I've included the 3 main ones here. So we've got health service discounts, NHS discounts and blue light card. The first 2 are a subscription base, so you don't have to pay for them. The blue light card is absolutely fantastic. It costs £5 for 2 years. I have saved that again and again and again. So please use that. You will get anything that you buy: shoes, insurance, household goods, white goods, your food, every single time you go out and do a family day out, anything like that. Use your blue light card, you will get money off. It's absolutely amazing. There's lots and lots of updates from money savings experts. So this is the Martin Lewis. He's recently just done a great kind of update for health and care workers. I've put the link on there. Please do have a look at it. There's some amazing stuff there. And if you do need to find a food bank, and I'm definitely not of the ilk that we should be setting lots of food banks up, because that's not the answer to the challenges that we've got. However, I do know and appreciate that people do need to access food banks. You can go to the Trussell Trust and find where your local one is. If you're struggling, please get in touch with me and we will help connect you to provision in your locality. I've talked about the kind of the cost saving cards. There are lots and lots of kind of provision schemes as well. So Healthcare Workers Foundation do one-off kind of grants and that are available to you. Please check it out. That's a new thing. The Care Charities Workers Charity offers support for care workers as well, so that might be applicable for some. And in particular for yourselves, please check out the Royal College of Nursing. So the RCN also has some discretionary grants that you might be able to access, so please do have a look at that. I've been talking about kind of financial costs and home costs, so there is a lot of housekeeping to be done. Helping Hand is something that's been put together by the GMCA, and that actually looks at the support that exists in each of your localities. So if you live in Greater Manchester, there's 10 localities, 10 boroughs. Please do have a look at that, and that will give you all the latest updates. They've just set it up, so it is kind of the information is still fresh, and they are updating it. If you think that you can make some cost savings around fuel efficiencies in your home, and we know our fuel bills are a really big issue, you might be able to access a £5,000 grant. So you can, you're able to basically improve either your heating or your windows, or get solar panels in, etc., etc. I've put the link there for Your Better Home. There's a kind of, you can do a little bit of a survey and a review, and then it will kind of take you through to the scheme. Please do have a look at that. Energy efficiency and kind of energy bills. There's a document that we've pulled together with colleagues from a London ICB, and there's some really great top tips. I won't go into that because you've got the link, and do have a look at that. If you haven't had your council tax rebate, and some people haven't yet had their rebate, chase it up. They should have paid it to you by now. It's a few £100s, and it will really, really help. And likewise, kind of fuel costs and renewal costs, please do use comparison sites, because actually, and if you use that in conjunction with a blue light card or a discount card, you might get some amazing savings. So do have a look at that. Some people's household circumstances might have changed as well. So do check what you're entitled to. The suggestion is that there are thousands and thousands of pounds that aren't actually being claimed at the moment in various kind of benefits. So there is a benefits calculator there. Do have a look at that. I won't go into these energy saving tips because it's all in that energy saving document, but needless to say, there's some really good kind of practical tips that you might want to have a look at, including the best kind of light bulbs. And I know I've got teenage children, and if my household is anything like your household, then actually I'm constantly turning lights off to save a little bit of energy. So please do have a look at that. Couple of things I really want to touch on, I've got about 4 minutes, is we know that financial well-being does impact on people's stress, anxiety, and can lead to more serious kind of impacts on depression and things like that. There is a really great technique called box breathing, which really helps if you get to that point where you're feeling overwhelmed, you can't find that pathway through, you can't navigate through a series of stress, then use this technique. At the bottom, I'm talking right-hand corner, there's a couple of links there. One's to an app called Tactical Breather, and another one is the box breathing technique. And I've tried to find the least Americanized version of this, so please forgive me because it's still there's a little bit of cheese in there, but it's really helpful. Practice it on a day-to-day basis. It's where you hold your breath for 4, you breathe in, you release it, you breathe out. So, and you just kind of keep doing that as a practice. And if you do that for a couple of minutes, it really does help with those anxiety kind of levels. And it's something that you just kind of can do on a regular basis. We've got the Greater Manchester Wellbeing Toolkit. I won't touch on that for too long, but actually there's lots and lots of great tools in there. We've got a whole section in there about financial wellbeing, but actually there's lots of tools in there about how we can manage some of the impacts of the stress of kind of financial pressures. This one in particular I really like. It's such a simple exercise. Draw a circle. If you're a list maker, you will absolutely love this. Make a list of all the things that are impacting on your stresses, your pressures, your anxieties, and then break them down into the things that you can do something about and the things you can't. And by just writing it down, you're almost acknowledging it and then putting it to one side. And then at least you've got a little bit of a clearer list of, actually, I can't do anything about that, so I'm just going to put that over there. But these are the things that I can do. So it almost creates a little bit of a strategy or a bit of a to-do list for yourself. So do have a look at that, and that's in the toolkit. And again, I've included the link there. The other thing that we know is that stress and pressure, especially around financial pressure, can impact on our physiology. So we know that MSK is massive at the moment in terms of its impact. We've got a couple of really great guides that we've been developing with our colleagues at Greater Sport and GM Moving. Please do have a look at them. One's around desk posture, so how we sit, how we move on a regular basis. And then another one is around exercise versus physical activity. So this is the whole thing about, actually, you don't have to be a mud runner or an Ironman or woman in order to be considered fit and physically active. That there is a difference between exercise and physical activity. Again, loads of great tips. Do have a look at that. And actually, we know that there is a correlation between people who do physical exercise, increase that adrenaline, increase those good hormones, those good happy hormones, and actually the ability to be able to then deal with pressures and impacts. So a lot of people use physical activity as a way of dealing with mental stress and mental pressure. So do have a look at that. It's really, really important. When things get tough, there is lots of support out there. So I've included quite a few things here. Talk to whoever your team leader, your line manager is. We've got a wellbeing action plan conversation kind of guide that might help with some of that. And then we've also got kind of how you have good conversations in the workplace. Look at the staff support offers that you've got around you. I've mentioned quite a few things, the blue light cards, you know, lots of things. Check out the Martin Lewis link as well, really important. Speak, if you've got access to an employee assistance program, speak to them. They do a lot of support around debt recovery, or debt support, sorry, not debt recovery, debt support, and helping to deal with some of that. And likewise, Money Helper is absolutely brilliant. I've tried to include as many of the most helpful links there, but everything from how to manage debt, making sure you're financially fit in the first place, looking at how you can plan for your budgets and your savings, and also kind of understanding the impacts that good financial well-being can have on your family and your caring responsibilities as well. There's a whole host of stuff. You can also ring them up and get telephone support. So if you're treading water with a number of kind of smaller debts that you want to try and consolidate, don't know the best way to do it, ring them up and ask them, because that's what they're there for. We've got the Resilience Hub. If you get to a point where you're really struggling, contact the Resilience Hub, and you can also contact the Samaritans, and there's loads of useful other resources, and we're going to go back in about 3 seconds, so hopefully that's been helpful.